But good morning, colleagues, esteemed colleagues. My name is Neeraj Wadhwa. I'm a DRPH candidate at Loma Linda University in California, and I work for the Los Angeles County Department of Public Health. And it's my privilege to present to you my dissertation research poster. As the speaker introduced me, the title of the research is Fentanyl Overdose Harm Reduction Intervention, a Pre-Test, Post-Test Study among high school students in Southern California. Let me talk a little bit about the background. There has been a big opioid epidemic in the US with a sharp rise in mortality and negative health outcomes affecting a lot of our vulnerable populations, such as the youth. The purpose of my research was based on a personal experience of an overdose of a high school student on one of the campuses. And I tried to work with the Substance Abuse Prevention Control Department at Department of Public Health to do something about that. So we decided to evaluate a harm reduction educational program to see if that would increase knowledge and awareness amongst the youth for harm reduction strategies and harmful effects of opioids. As you are maybe aware, harm reduction strategies for substance use are built upon the principle of managed use to reduce associated risk through education and resources rather than solely focusing on abstinence. And the harm reduction strategies what we are talking about include use of naloxone, which is a opioid receptor antagonist, and use of fentanyl testing strips that allows somebody to test for presence of fentanyl in the substance. This was a pilot study which was evaluating the effectiveness of two videos that were prepared by the Assistant Medical Director, Dr. Siddharth Puri, at the Los Angeles County Department of Public Health Substance Abuse and Prevention Control Department. And we were measuring changes in level of knowledge and attitude amongst adolescents in high schools in Los Angeles before and after intervention, which was the videos, with a 3-month follow-up. I want to bring your attention to some statistics about the background for a minute. As we know, opioid overdose has been a main contributor towards drug overdose death rate, which was around 108,000 in 2021 in the US. There was a 10-fold increase in opioid overdoses from 1999 to 2022 in the US, and fentanyl overdose death rate increased by 1,280% from 2016 to 2021 in Los Angeles County, with 1,504 deaths. Now, among adolescent, or which are youth ages 12 to 15, the fentanyl-related overdose death totaled to 31 in 2021, which was a 244% increase from 2019. So we see the problem really skyrocketed from 2016 up to 2021. We do see these rates are coming down marginally in the recent years because of all the work that's been done around harm reduction and awareness. But it still is a threat to the health of our youth in the community because youth are more susceptible to trying things. Their brains and bodies are still developing. And also earlier use of substance use has been linked to long-term health problems such as addiction. For this study, if you want to focus on the methodology section, this was a pre and post-test study design without a control. We recruited 76 students from 2 high schools within Los Angeles Unified School District campuses that gave us a power size of 0.78. The retention, however, was only 24%, which was a 3-month follow-up. And that led to a power size of 0.38, which we will talk about in a few minutes. Again, the intervention was a video that was based on educating the youth about harm reduction strategies, as well as harmful effects of opioids and fentanyl. And we had 3 main outcome variables that included overdose knowledge, naloxone knowledge, and attitudes towards opioid use in certain situations. The questionnaire was developed under the supervision of Los Angeles County Department of Public Health leadership, and we adapted part of it from Prescription Drug Attitudes Questionnaire. There were 8 multiple choice questions and 5 liquor type attitude questions. For data analysis, we used SPSS 29.0, and we relied on Wilcoxon's sign rank statistical testing method as our data was not normally distributed. I want to bring your attention to table 1 that basically highlights our demographic. Most of our participants were 9th and 10th graders. And as you can see, we have a retention of about 18 students after a 3-month follow-up. Table 2 is a summary of scores for measure of different variables. So the overdose knowledge, as you can see, went up from pre-test to post-test and even follow-up, the scores. These are the average scores for those categories. Then we have the naloxone knowledge, which scores also increased with the exception of post and follow-up. And I will talk about that in a few minutes. And then we have the attitudes, the negative attitudes towards use of opioids, which also increased towards more negative spectrum pre and post intervention. So those are some summary of average scores of actual instrument measures. Now I want to bring your attention to table 3, which is the basically summary of my statistical analysis. The results for each of the variables as evident that there was a statistically significant change for every variable with the exception of overdose knowledge from post-test to follow-up. Overdose knowledge showed statistically significant gains in knowledge from pre-test to post-test, indicating the intervention led to positive changes in the level of knowledge of overdose among high school students. Overdose knowledge dipped slightly between post-test and follow-up, indicating there was not a significant loss of knowledge between initial and retention intervals. However, there was not a significant increase either. Naloxone knowledge was significant at all 3 intervals, indicating successful increase in knowledge and retention information 3 months after the intervention. Lastly, the attitudes towards the use of opioids resulted in a statistically significant increase in negative attitude towards opioids at pre-test, post-test, and 3-month follow-up, indicating that students had held more negative attitudes towards use of opioids at all 3 intervals after viewing the videos. I would like to bring your attention to another point. There was a 3-month summer break between the post and the retention period, which may have contributed to a little dip in scores for the overdose knowledge because the youth have a tendency to move on quickly with information, and they are usually bombarded with a lot of information. So their attention span tends to be short. We also had a new class schedule in the fall, which meant it was a little bit more difficult to track down the original participants, all of them. So we had a low turnout rate at the follow-up. So we believe that the attrition contributed to us not being able to statistically statistically significant results for overdose knowledge between post and follow-up. I would like to just basically talk a little bit about what this means in the field of public health and implication for us in health education. Basically, harm reduction education has been shown to be impactful in this case, that it helped increase awareness and change negative attitudes of opioids use amongst high school students in Los Angeles County. Also, that harm reduction strategies such as use of naloxone and fentanyl testing strips could be effective methods of curtailing the opioid epidemic. It delivered a meaningful education that could potentially prevent future opioid overdoses amongst our population, while promoting safer practices associated with use of harm reduction strategies. Prevention programs such as these could be an effective way, an intervention which is feasible, cost-effective, and convenient in way of addressing lack of education, awareness, and access to resources in our communities. Lastly, for future studies, we recommend longitudinal studies undertaking a greater depth of information, including demographics and confounding factors, such as current use of opioids, gender, age, etc. We also recommend using a control group to increase the validity of the study. Down below are the references pertaining to the data in the background research on this poster. And lastly, I would like to thank all of you for your time. And also I would like to thank my project guidance committee at Loma Linda University, as well as the leadership at the Los Angeles County Department of Public Health, Substance Abuse and Prevention Control Department for their ongoing support in making this project possible. I ran a little bit short on my presentation, so I'm happy to entertain any questions if you may have.